Hello guys, welcome to my channel. If you are new, I am Adam Umar Nafada, a 5th year medical student, and I do videos on medicine and lifestyle. And in today's video, I am going to take us through the details about medical school examinations. If you are yet to subscribe, don't forget to click on the subscription button and the notification bell below.
Basically, medical school examination is divided into 3 segments: the written aspects, the oral or instrumentation aspects, and the practical or clinical aspects. Starting with the written aspects. The written aspect is basically constituting of 2 segments, which is the essays and the MCQs, or the multiple choice questions. Essays are meant to test our critical skill and clinical judgment, and usually focuses on the must-know aspect of our syllabus, and is usually details about certain clinical conditions or clinical scenario right from the introduction until the management of certain illnesses. Short essays are usually brief details of certain conditions based on the headlines like examples, diagnostic criteria, types, characteristics, and clinical features. Multiple choice questions, or the MCQs, is meant to test for our broader knowledge of the syllabus, and it is almost always attempt all the questions. It may be best of 5, single best answer, or true or false on each individual option. In this segment of exams, usually negative marking is applicable. So in this segment, individuals need to be extra careful. Second aspect is the orals or instrumentation aspect, and it is meant to test for our communication skills. In this segment, examiners has a right of asking anything provided that it is in the syllabus, although it can be pick and obey format. Students can also be provided with some instruments either to describe them or to give the details of how they are being used. The clinicals or the practical aspect is to test for all the previous skills with addition of our personality, or what we call the showmanship. Our dressing and appearance, our approach to the patient, our approach to the examiners, our attitude toward the examiners, our confidence, our composure, our clinical reasoning and decision makings. Practicals is for courses that are from Faculty of Basic Medical Sciences and Basic Clinical Sciences, while clinical exams is for courses that are from Faculty of Clinical Sciences, meaning that the practicals are carried out for courses including anatomy, physiology, and biochemistry, and all the 4 pathologies and the pharmacology, while clinical exams is for obstetrics and gynecology, pediatrics, medicine, and surgery. The practicals can be either OSPE or Steeple chess. OSPE is Objective Structured Picture Exams, and it is using projections for identification of instruments and certain features on humans, and also identifying their uses and functions. While Steeple chess is time-based objective exams. It is according to some stations where every individual will pass through, and certain structures and instruments will be tagged so that individuals will be mentioning their functions, their features, and also there are stations for performing short practical procedures. The clinical exams can be long case or OSCE, that is Objective Structured Clinical Exams, and it can also be OSPE, that is Objective Structured Picture Exams, as in the practicals. Long case test for detailed clinical skills, right from history taking, general examination, systemic examinations, investigation approach, possible diagnosis, differential diagnosis, and management. While OSCE consists of performing stations, counseling stations, and clinical scenario stations, where individuals are asked to conduct certain procedures like just a systemic examination of an abdomen, cardiovascular system, respiratory system, and neurological system. And OSPE is for making picture-based diagnoses and also certain procedures with instrumentations. Guys, that's all for today's video. I hope you enjoy it, and if you have any comments, suggestion, don't forget to share it with me in the comment box below. I will be more than happy to answer. Thank you for watching. Bye. See you next time.